COVID-19 has had a devastating impact on lives as well as livelihoods. Research company Ipsos has been looking quite specifically at the impact of on Africa, and it collected data from 19 countries and found that many have lost incomes, leading to poverty as well as hunger. But worryingly, it also found that over 40% of people are struggling to get medication or even healthcare. Let's discuss the findings with Murray Harris from Ipsos SA. Murray, thank you for your time and good morning to you. Let's talk about these long-term effects, of COVID-19 on the continent. What has your data, or rather your research, found?
Well, I think the biggest influence is the loss of income, as you mentioned. 3/4 of the people interviewed in Africa said that they have lost income. That is a huge number. And 80%, so that's 4 out of every 5, had comments about that it was difficult to get food. Food security is not what it was. And the other thing is that with COVID, I think a lot of the health facilities are not really coping. And more than 40% are saying that they don't get their regular medication, and if they need to get chronic medications, it's very difficult to get entry to doctors and hospitals. So yes, the influence on lives and livelihoods was, I think, worse than what we think, but also it came later than the epidemic in many other countries.
Yeah, and with that being said, what does the data then tell us about the work that, governments, for instance, private sector has to do in the long term, particularly when we look at, economically rather, as well as in the health sector, to ensure that people don't continue living like this?
I think the biggest thing is that governments need to work actively to inform people. There's a dearth of information about the vaccines. When will they be available? Where they will be available? We know that in South Africa, less than 1% of people have been vaccinated in this country so far. In other countries in Africa, like Zimbabwe or Ghana, the vaccinations are further down the line. But government and the health authorities, the continent-wide ones, as well as the country health authorities, I think need to inform people, because the biggest hindrance to getting vaccinated for people in Africa is that they're worried about the side effects of the vaccine.
Right.
And in my view, that is something to address. You can tell people what the side effects will be. You can speak to people who have been vaccinated so that there's some testimony of what happens when you get vaccinated. But that is the biggest hindrance at this stage, is that people are scared of the side effects.
With that being said, I mean, Africa has over 50 countries. Marie, how did you conduct this survey? And, what were some of the criteria or requirements that you have used here to sort of conduct this research?
The study was done for PERP, which is an agency that got together a lot of different agencies as well as governments working in the area of COVID. The World Economic Forum is involved, as Ipsos is involved, some UK agencies involved, and a lot of other agencies working in Africa are involved as well. This was the 3rd study in the series. The 4th one is going into field in June or July. It was done telephonically, and it is not 100% representative of the people in the 19 countries that we interviewed. In South Africa, however, 95% of people in this country have access to a mobile phone. So in South Africa, the sample is very good. In Kenya, Nigeria, those places, the sample is really good. And the beauty of this is that we can do the study in about a week or 2 in all the countries. So the circumstances that influence people are about the same all over the continent. And the study was done in February this year, as I said, telephonically, 24,000 interviews in 19 countries, all over the continent. Southern Africa, West Africa, Francophone, Anglophone countries, and in North Africa, Morocco, Tunisia, and Egypt.
All right, well, we'll leave it there, and thank you so much for sharing some of the findings with us. That is, of course, Murray Harris from Ipsos.